Due to its anti-inflammatory, anti-nausea, and other qualities, ginger may offer a number of health advantages. You could control your arthritis, lessen menstrual problems, and more with its assistance. Ginger is derived from a Southeast Asian flowering plant. It enhances the flavor of both savory and sweet foods and offers a number of health advantages. It is a member of the Zingiberaceae family and is related to galangal, cardamom, and turmeric. The subterranean, or rhizome, portion of the stem is what is most frequently used as a spice. It is frequently referred to as ginger root or just ginger. Ginger comes in a variety of forms: fresh, dried, powdered, juice, or oil. In addition to processed meals, over-the-counter treatments, and cosmetics, it is used in numerous recipes. What are 9 health benefits of ginger? Here are 9 health benefits of ginger that are supported by scientific research. 1. May help reduce cancer risk. Due to gingerol and other antioxidant and anti-inflammatory components, ginger may have anti-cancer benefits. These substances may help lower the risk of gastrointestinal malignancies such as colorectal, pancreatic, and liver cancer, according to some research. In one trial, 2 g of ginger was taken daily for 28 days by 20 participants with a high risk of colon cancer. The participants' intestinal lining exhibited less cancer-like alterations than was predicted at the conclusion of the trial. The majority of research on ginger and cancer risk, however, has not included human subjects. 2. Has strong medicinal properties found in gingerol. Ginger has a lengthy history of use in both traditional and alternative medicine. A few of its uses include helping with digestion, easing motion sickness, and fighting the flu and common cold. The natural oils in ginger, of which gingerol is the most significant, are what give it its distinct aroma and flavor. The primary bioactive ingredient in ginger is gingerol. Many of ginger's therapeutic qualities are due to it. According to research, gingerol possesses potent anti-inflammatory and antioxidant properties. For instance, it might aid in lowering oxidative stress, which is brought on by the body having too many free radicals. 3. May help lower cholesterol levels. An increased risk of heart disease has been related to high levels of LDL, bad cholesterol. Researchers discovered that consuming ginger significantly decreased triglycerides and LDL cholesterol while raising HDL cholesterol in a 2022 evaluation of 26 trials. Even daily dosages lower than 1,500 milligrams were efficient. It could be challenging to incorporate such large dosages of ginger into your diet, especially if you don't enjoy the flavor of ginger. 4. Could lessen menstruation pain. Menstrual pain, or dysmenorrhea, may be relieved with ginger. According to some studies, ginger may be more helpful at reducing menstruation pain than acetaminophen, caffeine, and ibuprofen, Navofen. However, more research is required. 5. Can help treat chronic indigestion. By accelerating the movement of food through the stomach, ginger may help treat indigestion. Functional dyspepsia is indigestion that occurs for unknown reasons and manifests as nausea, belching, abdominal pain, bloating, and a feeling of being overstuffed. With irritable bowel syndrome, IBS, it frequently happens. In one trial, researchers discovered that, compared to taking a placebo, having a ginger and artichoke mixture before a large meal dramatically reduced the symptoms of indigestion in persons with functional dyspepsia. 6. Can help with osteoarthritis. Joint degeneration is a sign of osteoarthritis, OA, which causes symptoms including stiffness and discomfort in the joints. According to one study, ginger may lessen discomfort and impairment. Depending on the study, the participants consumed 0.5 to 1 grams of ginger daily for 3 to 12 weeks. Most of them had been given a knee-OA diagnosis. Other studies, however, have not discovered proof of the same benefits. However, a lot of patients stopped their treatment because they didn't like the flavor of ginger or because it made their stomach feel uncomfortable. 7. May help with weight loss. Studies on humans and animals suggest that ginger may aid with weight loss. According to a 2019 review, ginger supplements significantly decreased body weight, the waist-hip ratio, and the hip ratio in those who are overweight or obese. Ginger may have a positive impact on weight loss through a number of ways, including its capability to lower inflammation. 8. Effective for treating nausea, including morning sickness. Ginger might be useful. Dependable source for information on nausea, including pregnancy-related nausea, morning sickness. Ginger may help people experiencing some types of surgery feel less sick and less likely to vomit, and it may also lessen nausea brought on by chemotherapy. Even though it's generally safe, it's best to consult a doctor if you're expecting before taking big doses. For women who are about to go into labor and those who have a history of miscarriage or vaginal bleeding, ginger may not be safe to use during pregnancy. It might not be appropriate for people who have clotting issues. 9. May improve heart disease risk factors and lower blood sugar. According to certain studies, ginger may have anti-diabetic benefits. In a 2015 study, 2 grams of ginger powder were taken daily by 41 participants with type 2 diabetes. A 2022 study discovered that using ginger supplements significantly lowered type 2 diabetics' fasting blood sugar and HbA1c levels. The study examined the outcomes of 10 trials in which individuals consumed 1,200 to 3,000 milligrams mg daily for 8 to 13 weeks. The findings did not imply that taking ginger supplements will change the lipid profile. After 12 weeks, their fasting blood sugar was 12% lower. Their hemoglobin A1c, HbA1c, levels were 10% lower. Their apolipoprotein B/apolipoprotein AI ratio was 28% lower. Their malondialdehyde, MDA, levels were 23% lower. Oxidative stress, a consequence of oxidative stress, can cause high amounts of malondialdehyde, MDA, and a high apolipoprotein B/apolipoprotein AI ratio. They both increase the risk of developing heart disease. To corroborate these findings, further study is required because this was a relatively small study. Although ginger may lower HbA1c in persons with type 2 diabetes, the authors of a 2019 analysis did not draw the conclusion that it can also drop fasting blood sugar levels. Conclusion: a variety of health benefits for your body and brain may result from the nutrients and bioactive compounds found in ginger. In addition to managing nausea, it may help ward against infections, lower cancer risk, and more. To prove that ginger provides these advantages, more study is necessary.